Does your stomach feel fairly normal when you wake up, but by evening, your waistband feels tight, your belly looks swollen, and you feel as if you have eaten twice as much as you actually did? That pattern is extremely frustrating, and after 60, many people simply blame it on age. But evening bloating is not always something you should ignore, and it is not always caused by eating too much. Sometimes the problem is swallowed air. Sometimes it is constipation, even when you are still having bowel movements. It could also be a food intolerance, one of your medications, or food remaining in your stomach longer than expected. In this video, I will show you 7 common reasons your belly becomes more bloated as the day goes on, a simple 7-day method for identifying your trigger, and the warning signs that mean you should speak with a healthcare professional. Stay until the end, because the difference between common bloating and concerning bloating is not the size of your stomach alone. It is what happens alongside it. What bloating actually means. Before we discuss the causes, let us clear up an important misunderstanding. Bloating is the feeling of fullness, tightness, or pressure inside the abdomen. Distension means the abdomen has physically become larger. You can feel severely bloated without looking different, and you can look distended without having severe pain. It often becomes more noticeable in the evening because you have eaten several meals, swallowed small amounts of air, produced gas while digesting carbohydrates, and accumulated stool and fluid throughout the day. That does not automatically mean something dangerous is happening. But new, persistent, or progressively worsening bloating deserves attention, especially when it comes with pain, vomiting, bleeding, or unexplained weight loss. Before we continue, tell me in the comments, is your bloating worse after a particular meal, or does it build gradually throughout the entire day? Your answer may reveal an important clue. Cause 1. Eating quickly and swallowing excess air. The first cause is surprisingly simple, swallowing more air than you realize. Every person swallows some air while eating and drinking. Most of it comes back up as a burp, but some can travel farther into the digestive tract and contribute to pressure and gas. You may swallow more air when you eat quickly, talk continuously while chewing, drink through a straw, chew gum, suck on hard candy, smoke, or frequently drink carbonated beverages. Loose-fitting dentures can also change the way some older adults chew and swallow. Here is a simple test. For the next 3 days, sit down for each meal, take smaller bites, chew slowly, and place your fork down between bites. Avoid straws, fizzy drinks, and chewing gum during that short test. If the pressure and belching decrease, swallowed air was probably contributing to the problem. Notice that I said contributing, not necessarily causing everything. Bloating often has more than one trigger. Cause 2. Large or high-fat evening meals. The second cause is not simply what you eat. It is how much you eat at one time and when you eat it. Many people eat lightly during the day and then have their largest meal in the evening. A large volume of food physically stretches the stomach. A high-fat meal may also increase the sensation of fullness and bloating in some people. Think about the difference between a moderate dinner eaten slowly at 6 o'clock and a very large meal followed by dessert at 9. Even if both days contain similar calories, the second pattern places more volume into the digestive system at once. Try moving part of your evening meal earlier in the day. Instead of one very large dinner, experiment with a moderate dinner and, if necessary, a small planned snack earlier in the afternoon. This does not mean seniors must eat tiny meals or avoid healthy fats. The goal is to discover whether meal volume is overwhelming your digestive comfort. If this information is useful, subscribe to the channel. We are building a complete senior digestive health series that explains symptoms without embarrassment or confusing medical language. Cause 3. Fermentable carbohydrates and sugar alcohols. The third cause is fermentation inside the large intestine. Some carbohydrates are not completely digested in the stomach and small intestine. When they reach the colon, gut bacteria break them down and produce gas. This is a normal biological process, but some people produce more gas or are more sensitive to the pressure it creates. Common examples can include beans, lentils, onions, garlic, broccoli, cauliflower, wheat products, certain fruits, fruit juice, and some dairy products. Sugar-free products deserve special attention. Sweeteners with names ending in OL, such as sorbitol, mannitol, xylitol, erythritol, and maltitol, can cause significant gas or loose stools in some people. They may be hiding in sugar-free gum, candy, protein bars, cough drops, and products marketed for diabetes. This does not make beans, vegetables, or fruit unhealthy. In fact, many of these foods provide valuable fiber and nutrients. The mistake is eliminating every nutritious food at once. Instead, keep a short food and symptom diary. Record what you ate, approximately how much, when the bloating began, and whether you also had constipation or diarrhea. Change one likely trigger at a time. If you remove 6 foods simultaneously, you may feel better, but never learn which food was responsible. You may also make your diet unnecessarily restrictive. A medically supervised low FODMAP diet can help some people with irritable bowel syndrome, but it is intended to be a structured, temporary process with foods gradually reintroduced, not a permanent list of forbidden foods. Cause 4. Constipation, even if you still go every day. The fourth cause is constipation, and this one surprises many people. You can have a bowel movement every day and still be constipated. The important questions are whether the stool is hard or difficult to pass, whether you strain, and whether you feel completely empty afterward. When stool moves slowly through the colon, gas and pressure can build behind it. That can make the abdomen feel increasingly heavy and swollen as the day continues. Constipation becomes more likely with lower physical activity, dehydration, changes in routine, certain medical conditions, and several commonly used medicines. Do not suddenly double your fiber because you heard that fiber cures every bowel problem. Increasing fiber too quickly can produce more gas and make bloating worse. Increase it gradually. Drink an appropriate amount of fluid for your medical needs, and include gentle daily movement if it is safe for you. Some people with heart failure, kidney disease, or other conditions have been told to limit fluids. If that applies to you, follow your clinician's fluid instructions rather than generic advice from the internet. And if you have severe abdominal pain, vomiting, or cannot pass either stool or gas, do not keep adding fiber or laxatives. Those symptoms require prompt medical evaluation. Cause 5. Lactose or another carbohydrate intolerance. Cause number 5 is difficulty digesting a particular carbohydrate. Lactose intolerance happens when the small intestine does not make enough lactase to fully digest the natural sugar in dairy products. Symptoms can include bloating, gas, abdominal discomfort, nausea, or diarrhea after consuming milk or other lactose-containing foods. But do not assume that every dairy product must be eliminated. Many people tolerate a smaller amount, lactose-free milk, or certain products better than others. Removing all dairy without replacing its nutrients may reduce your calcium, protein, or vitamin D intake. Fructose and other fermentable carbohydrates can also trigger symptoms in some people. The timing gives you a clue. If bloating repeatedly appears after the same food and improves when that food is carefully reduced, discuss the pattern with a doctor or registered dietitian. Testing may be useful in some situations. Do not diagnose yourself with gluten intolerance and begin a strict gluten-free diet before discussing possible celiac testing. Removing gluten first can interfere with the accuracy of some tests. Quick question: which seems to affect you more? Milk, bread, beans, or sugar-free products? Write just one word in the comments. That may also help another viewer recognize a pattern. Cause 6. Medicines and supplements. The sixth cause may be sitting in your medicine cabinet. Medicines do not affect every person in the same way, but several can slow bowel movement, delay stomach emptying, or contribute to gas and constipation. Examples include opioid pain medicines, iron supplements, some calcium-containing antacids, certain calcium channel blockers used for blood pressure, some antidepressants, anticholinergic medicines, and some medicines used for an overactive bladder. Some diabetes medicines may also cause digestive symptoms, and medications that slow stomach emptying can sometimes produce fullness, belching, or bloating. The clue is often timing. Did your symptoms begin after starting a medicine, increasing a dose, or adding a new supplement? Never stop a prescription medicine on your own. Bring every prescription, over-the-counter medicine, vitamin, powder, and supplement to your pharmacist or clinician. Ask one direct question. Could any of these be contributing to my bloating or constipation, and is there a safe alternative? Sometimes the safest solution is adjusting the dose or timing. Sometimes the medicine is essential, and the digestive symptom must be managed another way. That decision should be made with the professional who understands your medical history. Cause 7. An underlying digestive condition. 7. Digestive condition. The seventh reason is an underlying digestive condition. Irritable bowel syndrome can cause bloating along with constipation, diarrhea, or both. It involves changes in how the gut and brain communicate, how the intestines move, and how strongly a person senses pressure inside the abdomen. Small intestinal bacterial overgrowth, often called SIBO, may cause gas, bloating, diarrhea, and sometimes weight loss. But symptoms alone cannot prove that SIBO is present, and taking random antibiotics or supplements without a diagnosis can create additional problems. Celiac disease can also produce bloating and changes in bowel habits. Another possibility is delayed stomach emptying, known as gastroparesis. It may cause early fullness, nausea, belching, upper abdominal discomfort, or the feeling that food remains in the stomach for hours. Diabetes is one recognized cause, although many people with diabetes never develop it. Less commonly, persistent or progressive abdominal swelling can be related to fluid accumulation, inflammation, pancreatic problems, or a blockage. That is why a new pattern should not automatically be labeled just gas, especially if it is worsening. A clinician may review your symptoms, examine your abdomen, check your medicines, order blood tests, or decide whether imaging, breath testing, or another evaluation is appropriate. Not every person needs every test. A safe 7-day bloating investigation. Here is a practical 7-day investigation you can begin without buying a supplement or following an extreme diet. First, record the time your bloating begins. Is it present when you wake up, or does it appear after lunch or dinner? Second, write down your meals and approximate portions. Pay special attention to carbonated drinks, sugar-free products, very large meals, dairy, onions, garlic, beans, and sudden increases in fiber. Third, record your bowel movement. Was the stool hard? Did you strain? Did you feel fully empty afterward? Fourth, note any medicines or supplements taken shortly before the symptoms. Fifth, slow down your meals and remove fizzy drinks, straws, and chewing gum for several days. Sixth, take a gentle 10 to 15 minute walk after a meal if walking is safe for you. Movement can support normal digestive activity, but stop if you develop chest pain, severe breathlessness, or dizziness. Seventh, review the pattern at the end of the week. Do not look for perfection. Look for repetition. If milk repeatedly leads to symptoms, that is a useful clue. If symptoms appear only after your largest dinner, that is another clue. If bloating is present with hard stool and incomplete emptying, constipation may be contributing. Bring the diary to your healthcare appointment. A clear pattern is far more useful than simply saying, "My stomach sometimes feels bad." When bloating needs medical attention. Now we come to the most important part. Seek urgent medical care if bloating or abdominal swelling occurs with sudden or severe pain, repeated vomiting, vomiting blood or material that looks like coffee grounds, fainting, difficulty breathing, fever, a rigid or extremely tender abdomen, or an inability to pass stool or gas. Blood in the stool or black, tarry stool also needs medical attention. Arrange a medical evaluation for bloating that is new, persistent, or progressively worsening, especially if it comes with unexplained weight loss, loss of appetite, diarrhea that continues, worsening heartburn, anemia, a noticeable abdominal mass, jaundice, or feeling full after only a few bites. Women should also discuss persistent new bloating with a clinician when it occurs with pelvic pressure, urinary changes, or unusually early fullness. These symptoms do not automatically mean cancer or another serious disease. Most people with bloating will not have a dangerous cause. The purpose of recognizing warning signs is to investigate important changes early, not to create fear. Evening bloating may come from swallowed air, large meals, fermentable carbohydrates, constipation, food intolerance, medicines, or an underlying digestive condition. Instead of immediately purchasing a cleanse, probiotic, or digestive supplement, begin with the 7-day diary. Observe the timing, meal size, bowel pattern, and medicines. Then, take that information to a healthcare professional if the symptom continues. Your body is not betraying you. It is giving you information. The goal is to listen carefully without panicking and respond with the right next step. If this video helped you, press the like button and share it with someone who regularly complains that their stomach becomes swollen by evening. Subscribe and turn on notifications because our next digestive health video will explain why gas can develop a much stronger smell after 60 and when the odor may point to more than the food you ate. Thank you for watching. Take good care of yourself, and I will see you in the next video.